Dr. Jeff Elias, that is the head of functional neurosurgery at University of Virginia, and he is going to talk about the new technology called Exablade platform. So first of all, do you want to give us an introduction of this new technology?
Yes, this MR-guided focus ultrasound technology is a new technology that combines really two cutting-edge technologies. One is MRI imaging, as well as the therapeutic uses of ultrasound or high-intensity ultrasound techniques. And by combining these two modalities, we really have a powerful technology available to patients with many different disorders.
And how long does the testing period last, and when results will be spread?
Well, at the University of Virginia, we're using MR-guided focus ultrasound technology to treat essential tremor. Essential tremor is really the world's most common movement disorder, and it affects adults in their later years. Essential tremor is not a dangerous disorder, but it's very disabling for people at home and at work. And we're using this new technology, which is able to deliver sound waves or acoustic waves in a non-invasive fashion through the skull without any type of incision or surgery or traditional surgery to stop their tremors. We're using the technology in an FDA-approved clinical trial in the United States. It's a 3-month trial for each of the participants that are involved, and we're nearing the end of our phase 1 clinical testing.
Could you tell some of the patient stories?
Mm-hmm. Yeah, these are patients that people with essential tremor, especially the severe tremors that don't respond to medications, really lose the ability to do some of the basic things in life that we all take for granted. They have a difficult time eating with spoons and forks, or drinking coffee or water with in a glass. They have to use straws and tops to their drinks. They can't use screwdrivers. So it's a very disabling problem, whether you're at home or at work. The types of benefits we've seen right after the treatments, really within minutes after the treatment, our first patient was able to perform a crossword puzzle, which he had not done for many years. The last patient we just treated was able to write a letter to her family, which she hadn't been able to do for 10 years or so. So these are very profound interventions in their life that occur immediately after the treatment.
Very good. Well, until now, this technology was used for various diseases. But how much this technology is spread all over the world nowadays?
Yeah, MR-guided focus ultrasound technology really has been used around the world for many different disease applications. It's taken the most. It's had the most benefit and use with body applications like uterine fibroids, solid organ tumors, and prostate disease. And only recently has the technology been available to do transcranial sonications or treatments through an intact human skull. So we now have the technology available to use with many brain disorders. Pain problems have been treated in Zurich, Switzerland, and now we're treating essential tremor in the University of Virginia. And there'll be a lot more applications for the technology in the brain and in the body around the world.
Could you explain how it works, how the treatment works?
Yeah, the treatment combines the use of MRI and ultrasound technology. So there's an MRI compatible ultrasound transducer. It's shaped like a helmet, and the patient's head goes into this ultrasound transducer or helmet, and then their whole body goes into the MR scanner. So with this technology, we're able to watch the treatment on MRI while the ultrasound delivers the treatment. And that allows us the extreme precision of MRI with the therapeutic benefits of ultrasound.
And what kind of treatment would these patients have had if not this?
Well, patients with essential tremor typically will try medical treatments, but they're not typically effective for a lot of people. And they do have the option available to them to have contemporary stereotactic surgery, which either involves a radiofrequency lesion in the thalamus of the brain or deep brain stimulation targeted to the thalamus of the brain. These are surgical procedures that involve awake surgeries with cranial openings. So obviously they're treatments that are cause a lot of anxiety for the patients who are considering them. And the option or potential to have a non-invasive treatment available for essential tremor is really welcomed by the patients and their doctors.
What do you think the next steps are after essential tremor?
Well, there are a lot of trials being organized around the world to treat other brain disorders like stroke, pain problems, Parkinson's disease, and brain tumors.
What about epilepsy?
Epilepsy also will be, I'm sure, will be investigated in the near future.
Well, you just answered my last two questions, so we can be right with this.
And one other question, how long do you think the process is before this is available, FDA approved and generally available?
Well, obviously a lot of preclinical work has gone into the technology to the point where it's available for use in human clinical trials. We're currently in the first phase of human clinical trials in the United States. We're conducting a phase 1 clinical study of MR-guided focused ultrasound for essential tremor. And we're nearing the end of our phase 1 study and are currently planning or designing an additional study should our results continue to be so promising.
Will this new technology reduce costs for example, for an hospital?
Theoretically, this technology would be very cost effective if patients could come in and have the treatment and leave same day or have an outpatient procedure. That would be very cost effective as opposed to the contemporary treatments which involve hospital stay and expensive technology and equipment.
Is it easy to implement for the operators?
Well, obviously there's a learning curve. We've done lots of procedures to get to the point where we were able to use the technology in human clinical trials. But it has the potential to be very very labor efficient or user friendly.